Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Altman Health Systems, Studio Arts and Glass, and Genuine Appraisals and Liquidations, who has a tag sale this weekend. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. Denise Testa, audiologist with Hear the Possibilities. Good morning, Dr. Testa, and welcome back to the show.
Thank you so much for having me again. It's been a crazy 9 months since I opened my practice February 1st, but pleased to say that I've increased staff. I have hired one of my former colleagues. So there's 2 audiologists here now. I'm full-time and Amy's part-time, and we're just loving the dream here.
Sounds exciting. I'm very happy for you.
Thank you.
Okay, recently, the FDA permitted the sale of over-the-counter or OTC hearing aids. OTC hearing aids are designed to treat mild to moderate hearing loss in adults 18 years and older. This ruling is intended to help those who aren't seeking help from a professional audiologist due to a variety of factors that could include embarrassment or cost. This morning, we're going to talk with Dr. Testa about OTC hearing aids, their pros and cons, and other valuable information. We'd like to remind our listeners that our program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
Okay, doctor. Welcome back to the show. It's great to see you again.
Thank you.
Tell us a little bit about yourself, your background, and your training.
Okay, so I have been an audiologist now for almost 26 years here in the North Canton area. I received my undergrad and my grad degree from the University of Akron, and then I pursued my doctorate in audiology and graduated from the University of Pennsylvania in 2006. I was born and raised in Kent, Ohio. I met my husband at the University of Akron. We have been married 29 years now. And our oldest son just graduated from the University of Toledo and is working as a management trainee with Cintas Corporation. And my daughter is a senior at Lake High School and just loving her senior year. And now we're looking for colleges for her.
I see. Now, where's she thinking about going?
Well, she wants to cheer in college. And so her first choice was Bowling Green. But now she finds that might be a little too far for her. So Ashland University is one of her top choices. She's already applied and is been accepted, and her and my husband are going next Monday for her official visit, and she's going to meet the coach. And so she wants to go into journalism, but they also have a degree with computer arts with journalism. So that's what I think she's going to do.
Exciting. Okay. So tell our listeners about your practice and where you are located.
Okay. So my practice name is Hear the Possibilities. We are located at 6231 Frank Avenue, right across from the university, Kent Stark. And we're in the south building right up front. And so it's easy access for most folks to get here.
An audiologist, what kind of issues do you treat? Do you treat people of all ages, children, adults?
Yes. From newborns to geriatrics. I think my oldest patient right now is 102, and she still comes into the office. So, which is awesome to see her. And we treat hearing loss, balance disorders, tinnitus. Earwax is a big one, but there's a wide variety, and hearing aids, FM systems, sound protection, custom devices, so plethora.
So you clean out the earwax?
Oh, yes. It is very satisfying.
Oh, my gosh. Okay. All right. So hearing aids recently became available over the counter. Can you tell us some of the differences between OTC hearing aids and those you might offer in your practice?
Okay. So I'd like to back up just a little bit about the OTC and how they came about. So the general public typically believes at this point that it was just like, hey, we're going to do this. No, it actually started in 2017 by the FDA. It was called the Food and Drug Administrative Reauthorization Act of 2017. That was to establish and develop regulations for classification of OTC hearing aids in response to demands from consumers and government agencies for affordable and accessible hearing aids in the US. So what they've done now is there's now 2 classifications of hearing aids. In the past, the hearing aids that I dispensed, it was just a hearing aid category. We're now a prescriptive category, and OTC has their own category. There's another confusion that has also arisen, and patients are coming into my office asking, what's the difference between an over-the-counter hearing aid, a PSAP, which is a personal sound amplification product, as well as a hearable? Do you guys ever get any of those questions? So PSAPs are meant for individuals with normal hearing who want to amplify sounds in certain situations, like people that bird watch, hunters, and those are regulated as consumer electronics and not as medical devices. Okay, and the cost typically is less than about $100. Now, hearables are worn on the ear, headsets, earbuds, and wirelessly receive sound signal from another source. So from a phone, the television, an iPad. The headset itself might have a volume control or an app that's associated with it so that the individual can turn up the volume and turn it down. Hearables provide situation-specific listening solutions rather than a hearing solution for the whole day. And those cost anywhere between $300 to $500, okay? The FDA does not regulate PSAPs or hearables for safety and effectiveness like they do hearing aids and over-the-counter. So hearing is healthcare. Hearing aids are healthcare, not a consumer electronic device, okay? So now back to your original question. My office is going to be providing both over-the-counter and prescriptive, okay? Over-the-counter hearing aids are really meant for the patient that has a mild to moderate perceived hearing loss, not diagnosed. That's where the trouble's gonna occur, I have a feeling. And if a patient decides that, you know, I think I have this mild to moderate loss, I'm going to go to Best Buy and get a set of hearing aids. What we as audiologists really are proposing is get your hearing tested first. Just get that original diagnostic to see, are you in that category of mild to moderate, or is it worse than that? Because I'll tell you, 9 out of 10 of my patients that come in, when they have a diagnosed hearing loss, they don't really think it's as bad as it actually is. Now, on the other side of that, with the hearing aids over the counter that I'm going to have here, they're also going to get the service side of audiology, not just go get the hearing aid, try to put it in your ear. So these hearing aids, the over the counter, are pretty much one size fits most. And what we're worried about too is, are these patients that are buying these, are they going to overfit? Or are they going to be underfit? And then they're going to get a bad taste in their mouth again of reliability. Well, you know what? Hearing aids don't work. But on the other side, if they would come and say, hey, I bought this hearing aid, can I get some service for it? By all means. Patients that or customers that are buying hearing aids elsewhere, by all means, they can call my office. We can run verification on them to make sure that they're actually doing what they say. Because at this point, we haven't seen, as audiologists, any of the spec sheets that these hearing aid companies or these electronic companies are making these over-the-counter hearing aids. So we don't really know what they're doing. We know that there's rules and regulations that they have to follow, but we haven't seen anything to actually know what's going on.
Interesting. So have these new hearing aids, are they everywhere all of a sudden, or?
Well, they as of the 17th of October, they were released. So
Okay.
they're going to be able to be found online at Best Buy, Walmart, any retail store. Now, what is kind of ironic is that somebody had posted something on Facebook about hearing aid over the counters that were at Walmart that said, if you have any trouble with these, go to the ophthalmology center. They'll help you.
Wait a minute.
Because they're versed in audiology, right? So it is just so misleading for the consumers out there on, yeah, I can just pick this up and put it in my ear. Some of the hearing aids, or I have to stop saying hearing aids, the over-the-counters will be programmable through smartphones. Some will just have a volume control or like a little potentiometer for bass and treble. Now, I can tell you this factually and with transparency, that I have so many patients that come in that have a smartphone, whether it's an Android or an iPhone, they don't know how to download an app because they don't know their passwords, let alone buying an over-the-counter hearing aid and trying to program it on their own.
Oh my God.
So.
Okay, very interesting opening to the show. Time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy. Back to Health Matters with the Medicine Center Pharmacy. Don't forget to stop in for your flu shot or COVID booster. Walk-ins are welcome, and appointments can be made on our online medshop.com, medshoprx.com, excuse me. We look forward to helping you stay healthy.
All right, so we've been talking a little bit this morning about the new over-the-counter hearing devices. And, how does, obviously this is a touchy subject because some people don't want to admit that they might need some help. So how does someone decide if something like this might help them?
Well, I would say the easiest thing, or a couple rules of thumb. If a patient or a person is able to hear easily in quiet in one-on-one situations, are they having few difficulties in listening situations with a little bit of background noise, or are they turning the TV up just a little bit to get a little bit more clarity that's not considered overly too loud by someone else in the room? Those folks are probably pretty good candidates for over the counter because it would be situation dependent, not something that they'd want to wear all day long. That's really what over the counter hearing aids are for.
So why should I consider an OTC hearing aid?
Why should you? Because ideally, it would be the first step into just kind of like a starter device for those certain little situations that, again, like I had said before, that you're just having a little bit of trouble in. And they are reported that they are cheaper, and they are. However, there are some hearing aids that you can get through an audiologist that are comparable in price, just lower end technology, but still you get the service side, that kind of thing along with it. But I always recommend getting your hearing tested first, just to see where you are.
So is the answer to why shouldn't I consider them because you probably really should have your hearing tested first?
Yes, sir. That would be ideal. Yes. Okay. To just really get a base level too, or a baseline. And I've had some patients in within the last month, and they were really good candidates for over the counter. And one in particular, she said, well, I'll come back to you. Like, okay, I'll call you when the rules come out, because it was before that. And she said, I feel like I want to go to the professional, not just go to a store where I can get anything and everything. They're taking the expert out of that equation, which is not good. Yeah.
Any other pros or cons you want to bring to the attention of the listeners today?
Sure. There's a lot of them. So some of the pros that we were kind of going over, there's easier access for individuals that don't want to visit a medical professional. Cost will be lower. And sometimes the accessibility and the cost will entice someone to at least start out on the journey. And again, they are for hearing losses for mild to moderate perceived. Okay. Some of the cons is, the whole perceived rather than diagnosed. And there's no formal assessment, no medical evaluation is required. Thus, there's a risk. So some folks might have an ear infection, a sudden hearing loss, cholesteatoma, a malformed ear. All of those are reasons not to get an over-the-counter. And the devices have that one size fits most. And no one's going to be monitoring the progression of that hearing loss. And we know that our ear is an organ, just like the rest of us. It ages, and statistically, your hearing's going to change with time. So you want to make sure that you are getting tested regularly. And there's no verification that these devices are actually doing what they're meant to do for you. In our practice, every single patient that receives hearing aids has what's called a real ear measure, where we actually have the hearing aid in their ear, and there's a microphone that goes down, and we measure the levels of output for soft, average, and loud speech to see, are we meeting those acoustic targets? And if patients come into my office with a purchased over the counter and they're like, well, they're not working very well, even if I can't program them through my software, I can still put them on that machine to show them this is why you're not doing well, because there's really not enough output based on your hearing loss. The other thing that we're also concerned about is that the user satisfaction with hearing aids overall is not real good. So we're afraid that if patients are actually purchasing these over the counter, they're either under amplifying or over amplifying, which means they're not going to be happy. So it's like, oh, I tried this, and why would I, go pay more money for something else? That's a hard fact to swallow.
Are hearing aids taxable?
No.
Sales tax, even
No
the new ones, new over-the-counter ones?
I don't know about that. I would think no, because
okay.
they'll have the same rules and regulations that we have.
Sure.
So,
okay.
no. And the other thing that we weren't certain of is the return policy on the over-the-counter. Now, the manufacturers that are actually making them, they have to label their product. And we have seen now, I was actually doing some research for our talk, and most of the hearing aids have a 30 to 60 day return policy. Now, where are those going? Are they just packaging them for the next person? And so that's kind of scary. The other scary thing is these over-the-counters aren't meant for kids. And a really good friend of mine is an audiologist, an educational audiologist, and her and I were speaking this morning, and she's afraid that there's some kids that are going to end up in the school system with these over-the-counter hearing aids that aren't meant for 18 and younger. And I know that there was a gentleman, a colleague of mine too, that had found one of his patients came in with a sudden hearing loss, but what he did first was go to over-the-counter hearing aid. But he woke up one morning and was like, oh, I'm not hearing as well to this ear. I'll go just buy an over-the-counter. And that didn't work. So then he finally did the medical and had a sudden hearing loss that the hearing aid wasn't going to help regardless. So, but the person that was checking him out had no idea that he had a sudden hearing loss. So I don't really think that they're checking the pros and cons, or, why they should be buying them or not buying them, because they just made a sale.
So what do these over-the-counter units cost?
Anywhere between, what I've seen is anywhere between $300 and $600 a piece.
Gosh, no kidding. Not much. Jeez.
Mm-hmm. So they're not, like buying a wearable. Or
they're just sitting on the shelf, right? I mean, it's not anybody helping them in general.
No. But we did also find that one of the companies was promoting their over-the-counter as audiologist quality.
That's neat.
We're
I like
not
that.
a device. We are a service. And we would never
Oh,
promote that
gee.
on hearing aids, but yeah. So the general public has really been misled.
Okay.
Oh boy,
All right.
marketing at
That's
its finest.
Uh-huh.
my guess on the cost of manufacturing of these is probably less than a few bucks. If I, and I'm sure most of them are coming from overseas. We American companies don't seem to like to make devices, that are
Right.
whatever, with chips in them or something like that. And, so very interesting.
Yeah. And I know that all of the big five, there's the big five in audiology, the different companies that actually manufacture hearing aids. I think that real soon, like I know one in particular, Starkey had, they already have an over-the-counter device, but they're not selling them retail. You have to go to an audiologist to get those over the counter. And I believe that a couple of the other big ones, because I've heard some little, don't tell anybody, Denise, but this is what's happening. They're all doing it, but they're all going to be with the service side. You have to have a hearing test, but that's what I would ideally like to do here. But I'm definitely going to be available for anybody that buys the over-the-counter, because if their first experience was bad, I want their next experience in my office to be better.
Okay, so what about this? They buy an over-the-counter from you, they come back and it's not happiness. Okay, do you give them credit back?
Yes. Yeah, there will be a return policy. Yes.
Okay, well, that's interesting. Okay.
Just like there is with any of the hearing aids that my patients buy, the prescriptive hearing aids, there is a trial period that we legally have to give them. There is a cost to the patient if they return them. It's minimal, but I also have found in the past when there was no cost associated with the purchase, they weren't really, there had to be some stake in the game, and I've had one return in 9 months, which is not too bad. And in that gentleman's case, his family just kept pushing him and pushing him and pushing him. And I was like, this is the wrong thing to do. But he's like, I tried them and I don't want them, and I'm willing to pay you that restocking fee. I'm like, okay. But so I think the experience here is you just get a good patient experience from the time you walk in the door, or actually before that, when you call into my office. There's two ladies that are answering the phone, and they can answer all your questions regarding what your experience is going to be. And
okay, it's the bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center. Welcome back to Health Matters. I'm your host and pharmacist, Paul White. This morning, Brad and I are talking with Dr. Denise Testa, audiologist with Hear the Possibilities. We have a lot more to cover this morning, so let's sit back to the show. Curious question, Doctor. You've been open 9 months. How many things have you run into that you didn't think you were ever going to run into in opening a business?
oh my gosh, I think the hardest thing was the recredentialing on all insurances. It has not been an easy process, and I have hired a company to help me, and it still is not easy. So I think that has been my biggest challenge. And I can honestly say that I only get to be boss here twice a month. My practice manager, Michelle, tells everybody that she's the boss, but every other Friday I get to be boss because then it's payday. So I get to make payroll.
Well, when I opened the first pharmacy in 1976, I thought I was really smart, man. I found out in a few days that I wasn't really very smart about operating a business with all of the things that happened, and licenses
crazy.
and this and that and and this and that.
Right.
So
I just found that if you surround yourself with smart people,
sure.
there was so many people that I have to thank that came out of the woodwork to help me.
Right.
Because, I just wanted to make lemonade out of the lemons that were delivered to me. And
Yeah.
it has been way better than that. It really has. So again, thank you for letting me be on your show again,
No,
because I will get patients call in. Denise, I heard you. Can we call in and say good
what
things?
do you have any idea what percentage of the population has hearing issues?
Oh my gosh. I should know that, but
It's got to be enormous.
it is.
I would think.
And, on average, people wait, a good 7 years to do anything.
Right, all right,
Mhm.
right.
That's
right.
that's why there might be a little hope for the over the counter to get somebody started in that journey earlier. But I think that the FDA and the government did an injustice to our elderly population in regards to over the counter. I think they really should